Good evening, everyone. I am Dr. Rohini Ruhil. I am PhD in Social Medicine and Community Health from JNU. I have done two masters, one in health management and other in rural development. And fortunately, I received gold medal in both the masters. And I am also BDS by graduation, that is dental surgery. So, to start with today's presentation, it is about MDGs and SDGs. You must have heard about Millennium Development Goals and Sustainable Development Goals. First, let us understand what is the relationship between development and health. If a country is more developed, there will be more resources to put in people's health, taking care of people's health, and people will be more healthy. And vice versa also, like if people will be more healthy, we will have a productive workforce, a healthy workforce, and they will put in their efforts towards the development of the nation. Thus, development and health goes side by side, and there are strong interlinkages between the two. Now, to start with Millennium Development Goals. So, it started in 2000, and there was a Millennium Summit of the United Nations in which 189 member countries participated, where these Millennium Development Goals were put forth. This was a kind of framework to guide global developmental efforts. So, the time frame was from 2000 to 2015. So these Millennium Development Goals, they were put forth in 2000 in the Millennium Summit of the United Nations, and there were 8 goals which were to be achieved by 2015. Now we had certain targets under these goals, like the target, how much we have to achieve. So there were 18 targets and 48 indicators. Goal are broad goals, and then targets are some specific milestones which we have to achieve under these goals, and indicators are used to measure our progress towards these targets and goals. So these are the 8 goals. You can go through this. The first most important goal was eradicate extreme poverty and hunger. The major problem the world is facing is that lots of people, they do not get 2 times meals and they sleep hungry. And then there is no meaning of development if a large section of society sleeps hungry and do not get proper meals. So first, the most important goal was to eradicate extreme poverty and hunger. The second goal was to achieve universal primary education. You must have seen that many school students, they drop out in between. They are not able to complete even their primary education. So this goal aims towards the achievement of universal primary education, that every child should at least achieve primary education. Then third most important goal was to promote gender equality and to empower women. Like 50% of our population, if they do not participate in economic activities, and if they are not empowered, then there is no meaning of development. So this third goal is also very important. Then fourth goal was MDGs 4, 5 and 6 were directly related to health. The goal 4 was to reduce child mortality rate. Goal 5 was to improve maternal health. Goal 6 was to combat HIV, AIDS, malaria and other diseases, and tuberculosis was there in other diseases. Now goal 7 was to ensure environmental sustainability. This is again very important, because as we studied previously, that there is no meaning of development if we are harming our nature, if we are mindlessly consuming things, and we are leaving nothing for our future generations. So our consumption should be limited. Our consumption should not be mindless, and the development should be sustainable. Now, to achieve these 7 goals, there is a need for global partnership. The world needs to come together. There should be coordinated efforts. There should be collective efforts. So, seventh most important goal was to develop a global partnership for development. Now you can study all these goals in details, the targets under these goals and the indicators under these goals. Now we will focus on the health related MDGs, which are 4, 5 and 6. Now to start with the MDG 4, its target was to reduce by 2/3 between 1990 and 2015 the under 5 mortality rate. So this may come in your MCQs that by how much we had to reduce, by what proportion. So this that 1990 में जो आपका अंडर 5 मोर्टेलिटी रेट था उसका 2/3 कम करके आपको चाइल्ड मोर्टेलिटी को कंट्रोल करना था by 2015. And the indicators under this was under 5 mortality rate, infant mortality rate and proportion of 1-year-old children immunized against measles. Now what is under 5 mortality rate? जो 5 years से कम के बच्चे हैं, 5 years से ज़्यादा नहीं, उससे कम के जो children हैं उनमें जो mortality होती है, that is under 5 mortality rate. Now infant mortality rate is again very important indicator to measure the development of a nation. For example, a country has very high GDP, but infant mortality rate is also high in that country, then there is no meaning of development. So what is an infant? Infant is a child less than 1 year old. So this was about reducing the child mortality. Now coming to MDG 5, which was to improve the maternal health. Then again here target is very important, that by how much proportion you had to reduce. So here the indicator was maternal mortality ratio, and by how much you had to reduce maternal mortality ratio? 3/4. 3/4 means 75%. Right? And now what is maternal mortality ratio? What is maternal mortality? So maternal mortality is death of a pregnant woman due to pregnancy related causes or the causes exacerbated by pregnancy, either during pregnancy or within 42 days after childbirth. So if a pregnant woman dies 41 days after childbirth and due to the pregnancy related causes or the causes exacerbated by pregnancy, then also it is maternal mortality, right? And this was about the maternal mortality ratio, and which we had to reduce by 3/4. Then another target was to achieve universal access to reproductive health by 2015. Now here they were talking about the reproductive health, and to measure reproductive health they had various indicators. For example, contraceptive prevalence rate, adolescent birth rate, antenatal care coverage, unmet need for family planning. Right, so this you can study in detail. So this was about improving the maternal health. Now MDG 6, combat HIV, AIDS, malaria and other diseases. Here also we had various targets and indicators which you can study in detail. So India made significant progress towards health related MDGs, particularly in reducing child mortality and improving maternal health. But what was the drawback? The drawback was that this progress was not uniform throughout the country. Some states made great progress while some states were left behind. And also across the different sections of the society, different socioeconomic status, the better of people, the people with high socioeconomic status or upper middle socioeconomic status, in that strata of society we achieved progress, but in the lowermost strata of the society, the poorest of the poor, they still suffer from these problems, the problem of infant mortality, maternal mortality, which is highly prevalent among those sections of society. So this was the major drawback. Then other limitations of MDGs. If we talk about health related MDGs, then non-communicable diseases were not included in MDGs. They were left behind. And apart from health, certain other issues were also not included. For example, human rights and transgender issues and certain other issues. And also the participation of Global South was very limited. and kind of they were not so much of democratic and universal, but these limitations were later on covered by the SDGs, Sustainable Development Goals, which we will study in our next presentation. Coming to a few mock questions, like what kind of questions are asked. First, I told you they might ask you like what proportion of the indicator we had to achieve. For example, this is regarding MDG 1. What was the specific target for reducing the proportion of people living on less than $1.25 a day by 2015? मतलब कितना प्रोपोर्शन हमें कवर करना था कि जो एक दिन में $1.25 भी नहीं कमा पाते, ऐसे लोगों का कितना प्रोपोर्शन हमें कम करना था. तो ऐसे लोगों की हमें बाय हाफ हमें पॉपुलेशन कम करनी थी. तो these kind of questions. This is regarding under 5 mortality rate, maternal mortality की कितने proportion से कम करना था. This you can go through. And फिर other like which of the following diseases was not a specific focus of MDG 6. तो MDG 6 में हमारा HIV AIDS था, मलेरिया था, ट्यूबरक्यूलोसिस था, पर डायबिटीज इसमें नहीं था. तो these kind of questions. Then MDG 2 में हमने स्कूलिंग की बात की थी. तो कौन से लेवल ऑफ स्कूलिंग की बात की थी? प्राइमरी एजुकेशन, यूनिवर्सल प्राइमरी एजुकेशन की हमने बात की थी. सो थॉरोली यू नीड टू अंडरस्टैंड ऑल द गोल्स, इंडिकेटर्स एंड देयर टारगेट्स. देन MDG 7 है जो हमारा एनवायरमेंटल सस्टेनेबिलिटी से रिलेटेड है. उसमें इनमें से कौन सा टारगेट नहीं था? तो उसमें हमने सेफ ड्रिंकिंग वाटर, बेसिक सैनिटेशन की बात की थी, 100 मिलियन स्लम ड्वेलर्स की लाइफ को इम्प्रूव करने की बात की थी, एनवायरमेंटल रिसोर्सेज की बात की थी, पर MDG 7 के अंदर ओजोन लेयर डिप्लीशन से रिलेटेड टारगेट नहीं था. फिर है कि MDG 8 जो हमारा ग्लोबल पार्टनरशिप से रिलेटेड था, उसमें क्या अवेलेबल करना था न्यू टेक्नोलॉजी से रिलेटेड. ग्लोबल पार्टनरशिप तभी होगी ना जब हम न्यू टेक्नोलॉजीज को अडॉप्ट करेंगे. तो ग्लोबल पार्टनरशिप के लिए क्या चाहिए? इंटरकनेक्टेडनेस चाहिए. इंटरकनेक्टेडनेस के लिए हमें ICT चाहिए, इंफॉर्मेशन एंड कम्युनिकेशन टेक्नोलॉजी. आर्टिफिशियल इंटेलिजेंस उस टाइम पे इतना नहीं था, बायोटेक्नोलॉजी और नैनो टेक्नोलॉजी से रिलेटेड नहीं है. तो इसमें कौन सी टेक्नोलॉजी की हम बात कर रहे हैं? इंफॉर्मेशन एंड कम्युनिकेशन टेक्नोलॉजी. So this was all about the MDGs. So rest of the things we will study in detail in SDGs. Thank you very much.